Hello everyone. A very warm welcome to each one of you for this very special orientation session for your Nclex. As you know, the orientations are always important because here you will be get a complete overview about the whole course. Apart from that, you will be shared the schedule for the sessions and icing on the cake. You have a chance to meet with our CEO, Dr. Akram, and your very favorite faculty for the session. Without taking much time, let us proceed. So as you can see on your cameras right now, Dr. Akram is there, and the whole academically is the brainchild of Dr. Akram, and he himself has done a lot of research and the other works. He has completed his B Pharm, D Pharm D, PhD, and he's highly qualified and skilled clinical pharmacist and a lecturer who has worked in leading universities in India, Australia, and Malaysia. With teaching and research experience surpassing 10 years, he works towards the goal of helping qualified healthcare professionals across the globe to move their careers in the best direction. So I guess I just hand it over to Dr. Akram. So over to sir.
Oh, thank you so much, Bharti. So I think Bharti already gave this introduction about myself. So I'm currently based in Sydney. So you guys, once you pass this exam and coming to Australia, hopefully I will see you. Some of you, if you are coming to Sydney, but you pass this exam, and then as I mentioned that earlier, today I did my lot of research regarding the nursing professions in Australia. So I found, lot of vacancies is there. Even I found about 500 advertisement. They are ready to give a sponsorship. So a lot of things are available. You just need to pass. You just focus on exam. As other things, you will automatically, you will very close to your aim. Okay. So basically, our vision, basically, so it's like one-stop solution for you. So we can help you to migrate Australia like A to Z assistance, like skill assessment, exam, English preparation, and later on, the OSCE and visa, all those things. So we will help you. Okay. So we always be there whenever you need. So all those things basically in our mission to academically there to with like dream your come true to complete this process, because many of you are not aware regarding the process and all those things. So no need to worry, we are here to help you. Yeah, then I think I hand over to Miss Kavita, and she will take care from now onwards. So for the Nclex faculty. Hi Kavita, welcome.
Hello, sir.
Yeah. So as you can see on your screen, she is your instructor, Kavita ma'am. And she is associate professor of child health nursing from India. Ma'am has completed her nursing from National Institute of Nursing Education, PGIMER, Chandigarh, a premier institute of medical sciences and research in India. She is a gold medalist MSc nursing from SGRR College of Nursing, Dehradun. And not to left that she is already Nclex certified, and she has a vast experience of over 13 plus years, during which she has worked in different nursing job profiles. So over to Ms. Kavita.
So I'll be your Nclex trainer. Hello, students. So today is just an orientation class. So I'll be giving you an outline of what it is about the Nclex and what our coaching will include. Okay, so all of you know that Nclex is a licensure examination which is required to become an RN in a few countries like US, Australia, and Canada, and in New Zealand also. So we'll be going step by step in this whole coaching of 3 months. I hope you know it's a duration of 3 months coaching, and we have a schedule outlined already. And you will be able to that calendar. I think it has been shared, or it will be shared with you. And everything is pre-planned, so it has been adjusted according to different timings of every student, because all of you are in different areas, no. But it's still, while after we start the classes and then some kind of adjustments need to be made, then we can you can share your views and then we can decide if it can be done. Okay. So about the Nclex exam. Okay, so first of all, you need to know what is and why it is required. It is required to become a registered nurse, and it is a CAT format, computerized adaptive testing. Means one important thing which you need to know is that Nclex is different from other exams. How? Because there's no set standard question paper. Means the question paper is not same for every student. For each computer screen, there will be questions when you appear for the exam. And according to your answers, means if you are able to answer a particular question, then a little higher difficulty level question is administered to the student. So it is individual capability based um, examination. That is why it is computer adaptive testing. And so the pattern how it goes is like if you answer one question correctly, the next question is a little difficult from the previous one, and then if you answered that also correctly, then the next will be a little more difficult. So in this way it progresses, and in between if you're not able to answer a question, then the next question will be a little less difficult. So it keeps on going like that. And overall it is the question paper of minimum 80 questions and maximum 150 questions. So earlier it was used to be a very lengthy paper of 6 hours. Now it is only of 5 hours duration, and you can take breaks also in between. So whenever the computer screen indicates that it is time for break, you can take, and your timing is included in that 5 hours only. The break is also included. So what happens is when you appear for the exam, no, starting 15 questions are only like kind of a warm-up questions, and they are not scored. So minimum questions are 80. What do you mean by minimum and maximum? That I'll explain. Like if for every student, no, the question number will be different. Like if you answer 80 questions very well, then your computer can turn off at 80 also. It is online kind of exam, and sometimes you have to answer 90 or 100 questions, so it varies according to students. So main basic concept is that if you answer questions very nicely, then also it can shut down at 80, and if you answer questions very badly, then also it will shut down at 80. So basically computer tries to gauge what is the performance of the student. So after the results only you will be able to know how you have performed. Okay, so that is what the pattern of Nclex exam is. So this is basically the NCS BN test plan. This is the next generation Nclex, which is started from April 2023. And this is the distribution of the different types of questions which you get in exam, right? So I'll just read out. So there are different sections, like we have divided the preparation for Nclex in the form of specialties like FON, medical, surgical, nursing, child health nursing, etc., which every section will include all these major areas. So they have divided the areas like management of care related questions will be 15 to 21% of questions in the NCLEX exam will be from management of care. So what management of care means, like there are different terms you will be studying, like advanced directives are there, end of life care, then how you are going to delegate things to the juniors, like that. All these stuff is included. So those types of questions will cover at least 15 to 21% of your final NCLEX exam. Then safety and infection control questions will be there on a percentage of 10 to 16% of questions. Then health promotion and maintenance will be 6 to 12% of the paper. Then psychosocial integrity means mental health nursing related concepts. They will be 6 to 12% of the whole question paper. Then physiological, the rest of the things have been divided into, they have been categorized into physiological integrity. Means all the subspecialties, no, which you study, OBG nursing, child health nursing, and medical surgical nursing, everything has been classified under physiological integrity. So in this, basic care and comfort comprises of 6 to 12% of your paper. It mainly deals with the basic hygiene of patient, like all the procedures and concepts which you study in fundamentals of nursing or from nursing foundation, that will become included in basic care and comfort, and that will comprise 6 to 12% of your question paper. Then pharmacology portion will be, it is a huge amount, 13 to 19% of your paper will be from pharmacology. And as you know, there are a huge number of drugs in pharmacology, so you need to learn and practice more and more names of the pharmacological drugs and calculations. Then reduction of risk potential means on those topics in which we are trying to protect the patient, like preventing any kind of injuries, falls, or infections. Different variety of topics will be included. So questions based on the reduction of risk potential topic will be 9 to 15% of the total exam. Then physiological adaptation, 11 to 17%. So very technically, they have divided the question into different formats so that the whole knowledge of a nurse is tested. So there are different types of questions in the NCLEX exam. Anyone has an idea? Have you ever seen on online or any pattern of questions? Akshay, Harshal, Florence, anyone can answer?
No, ma'am.
No, you haven't searched?
I did try to search,
Mm-hmm.
and I found the one question that they said, choose the correct answer within the four, or if they said choose any that applies. There were four,
Okay.
like A, B, C, D, and then they tell you to choose at least, maybe it's more than one. In short, you can choose
Yeah.
another one that's
Yeah. So earlier there used to be only two, three types of questions. Like out of four options, you have to choose one, or that is known as single response answer. Then select all that apply, which is like first one, as you can see on the slide, single answer means four options will be given to you and one answer you have to select. So earlier there were very few limited options, but now many new types of questions have been introduced in Nclex. The second type of question is multiple answers or multiple response. You have to select, which is also known as select all that apply. SATA stands for select all that apply, means there will be a question and you will be given five or six options, and out of that, even two options can be correct or all five also can be correct. So you have to answer those very carefully, because in such type of questions there is negative marking also. So in that way they have increased the difficulty level of the questions. So that is the second type of questions in which there are multiple responses. Then image based and audio based were included earlier also. There will be an image and related to that question will be asked, or you will be given some audio, and audio means you can be here you must be hearing some breath sounds or vowel sounds, or any other thing like fetal heart sound. Different, any audio can be given to you and you have to interpret. Then calculation questions were also there before, like mostly drug calculation will be there. So there will be a blank and there will be no options. You have to calculate on your own, or sometimes like we calculate the percentage of body surface area burnt in burn patient, no, that calculation can be there. So in these calculation type of questions, you will be given a blank box. So you have to calculate and write. There are no options. Then in fill in the blanks also, one word answer is there, but there are no options. Then arrange in order means like for a particular process. Like for example, you are a question is given related to installation of eardrops, and there are steps of every process, no? So there will five or six steps will be given to you, and you have to arrange them in order. So in that case, you have to drag the options and arrange them in that order. That is arranging in order. Then new concept has been introduced, which is known as the case study based. So this is something means those nurses who have worked in the clinical area, for them, because I teach many students, no, so usually those students do not find it very difficult, but those who are not exposed to the general ward patients or in the ICU also, they sometimes find it difficult, but we'll practice them and you will come to know. So what is case study based question? Like a particular case scenario of a patient is given to you, like you must be given history or progress notes of the patient will be given to you, then nurses notes might be given to you, or the laboratory results of a patient, and then following that case study there are two types of questions. One type is that in a case study is given and one question is there in which there will be different responses. And sometimes a case study is given and followed by the case study, six questions are there. So both type of case studies you will be getting in your final exam. So when you have one case study and six following questions, then there are different types of questions. Like you have to highlight the main findings from the patient's history. We'll be practicing that, so that will be more clear to you. So, but in this type of questions, no, there is negative marking also, which I'll show you in next slides. So this is an example of a case study question. I hope it's clearly visible. Like nurses notes, physical history and physical examination will be given to you. You have to read it very carefully. And then this on the left side. Then on the right side, every body system assessment has been given to you, right? So in this way, it will be presented. Then after this, like again, this is given. So multiple responses will be there, and correct answer will be getting you 1 point, and there is no negative score in such type of questions. Then this is one important major thing where there is negative marking. Like after a case study, this is a part of question of the case study only, right? a section of questions. Like in the screen, you can see you have to read the history of patient, and after that you have to answer whether the clinical findings of patient correlate with which of these diagnoses. Like in this case, in example, it is written MI or pneumonia or pulmonary embolism. So matrix boxes, this is known as matrix multiple response, means boxes are given to you and you have to tick. Dyspnea will be, if the patient is having dyspnea, so he might, dyspnea is present in which of these conditions, you have to tick. Okay, so in these responses, no, there are multiple responses. Like dyspnea can be present in MI also, pneumonia also, pulmonary embolism also. But sometimes chest pain, it's not present in all, right? So if you tick mark any box wrong, then 1 point is deducted for each wrong answer. So it's a kind of tricky thing which you have to do very carefully, right? So this is one type of question after a case study. So this is the general simple question. Case study, I hope you have understood what is case study type of questions. This is just simple question on screen, like 4 options are given and you have to choose one. So there is no negative score for this. Only if you answer it incorrectly, you will be given 0 point. Otherwise, there is no negative scoring. Then this is which I was saying, multiple response answer or select all that apply. A question is given to you, and in the end of the question, it is written select all that apply. It is highlighted. So keep that in mind. Sometimes students are in a hurry to attempt the question and they do not realize that you have to select more than one options, because sometimes maybe only 4 or 5 options are given. Like here 6 are given, so you can see clearly, but sometimes only 4 or 5 options are given, so you might miss that you have to select more than one option. So you have to read very carefully. Like in this question, there are 4 correct responses, right? But again, because here also there are multiple responses, so if you answer incorrectly any of the boxes you tick, then 1 point will be deducted. So that you have to keep in mind. Now this you have to keep in mind for all the 3 months, okay? Because we'll be practicing different types of questions and many times students ask in between the classes also. So just remember, in the case study matrix type questions and in this select all that apply, there is negative marking. Next slide, ma'am. Then this is another type of question, drop boxes are given to you and you have to choose from the drop box. Like for example, the nurse understands that client is most at risk for dash and dash. So you have to select from the drop box. But in this case, there is no negative marking. Okay, so two of the options you have to select. I hope it's clear to you whatever I'm telling, all of you.
Yes, ma'am.
Okay, anything you want to ask in between, you can ask. Okay, this is another type. Like in this, you have to be careful. This is also following a case study. Okay, these are parts of questions from case study. For example, here it is written the nurse should prioritize interventions to treat dash due to the risk of dash. So you see these two answers are related. So if both are correct, only then 1 point will be given. Otherwise, if you are writing hyperkalemia, but then you are not writing dysrhythmia, then there will be no point, but there is no negative marking. Okay, so both boxes have to be correct to get 1 mark, but negative marking is not there. Okay. So these are the different types of questions. Then the test taking strategy, it is the general thing which I'll be just telling you, but they are very, very important. So this might seem to be just a casual slide, but it is very important in Nclex. You have to read the question at least twice because the questions are very tricky. Like they give cues in the question also, no? Like sometimes the age is mentioned or sometimes a particular sign is mentioned. So you have to read the question very carefully. Sometimes they might have mentioned the route of administration of a drug. So according to that, the answer changes. So read the question at least twice. Then second is read every option completely and carefully. Many times students just read half of the option and then they jump to write down the answer because they are overconfident about certain things which they think that they know accurately. So don't do that because in Nclex questions are tricky. So if you read them twice and read every option properly, then it can be solved. Okay, then ask yourself what is the question asking and what content is this question testing, right? So you have to, when we will be practicing questions, you will come to know what this means. We have to completely understand the question. Like many times a pattern of Nclex questions is there is negative responses, like a nurse has given health education to the patient regarding something, like maybe regarding diabetes. And after the health education, this patient makes the following statements. Which of the statements indicates that the patient needs further teaching? So that means you have to choose the statement which is wrong by the patient, which indicates that his health education is not complete. So in that way, it is saying that you have to ask yourself what is the question asking. It's not always the correct, like it is not direct question that you are asked something, you will write this is the answer. Sometimes you have to completely understand whether you have to identify the correct statement or the wrong statement, right? Then look for the signal words in the question. This is very important, and usually these words are highlighted in the question. Like a scenario is given, and they will ask what will be the first action by the nurse. So, first word will be highlighted, or what is the priority out of these actions. So, priority will be highlighted. And similarly, initial step, immediate step, best therapy. So, these kind of words you have to look out for. And in such questions, many times you will feel that out of four options, three are required to be done for the patient. So that might confuse you. But in that case, you have to follow this. Like you have to choose the best or the first or the initial. Like in many answers, the first response is informing the healthcare practitioner or the physician. So even though you feel that patient needs this thing to be done, but first you have to inform the physician. So in that way, you have to look for the signal words in the question. Okay. Then use process of elimination. Like after following all these strategies, you have read the questions properly, you have read every option properly, and you have kept in mind the signal words also. Still, sometimes you are not able to find out the correct answer, then you can use the process of elimination. Process of elimination means sometimes we have a question, we have four options in the answers. In that four options, you should try to eliminate the wrong ones first. Okay, so if you do that strategy, if you take that strategy, then you will be able to reach to the correct answer. Let's say out of four options, you feel that the three are not correct, so they will be eliminated, and in that way it will help you to reach to the correct answer. So these are basic stress taking strategies which you should be following, which will help you to attempt NCLEX questions which are different from the normal entrance examinations. So this is the basic information about what is NCLEX exam and how you're going to attempt the questions, what are the different types of questions, and what is the division of different areas of nursing, like health promotion, basic care, etc. And every part of these will be included in your practicing. But important thing is that you have to plan your study schedule, right? So we will be doing 2 hours class daily, and calendar will be shared with you. But apart from that, you have to do a lot of self study also, and preferably at least 4 to 5 hours per day you should be giving to your study. If you are working or you have family or something, you have to adjust timings accordingly, right? But you have to give a lot of time. One thing is that, and second is that you have to practice more and more questions. Like in the class, we won't be able to do many questions, no, because it is a live class. So apart from that, I will be sharing when we start classes, I'll be sharing all the content will be shared to you, whichever I will be teaching in the class. It will be recorded also, and the written content will be shared in the website of Academically. And apart from that, the book PDFs will be shared with you, and at least one to two books you should be buying, okay, so that you can practice on your own also. Because NCLEX is mainly practice, practice, and practice. You have to practice a lot of questions, right? Because the different types of questions we will be administering. But like for example, in pharmacology, whatever number of drugs you study, there are still more to study, right? And second thing which I think students find difficulty in is the diet recommendation. There are multiple types of food items, and there are different cultural differences also. So in Australia or in New Zealand or in Canada, different types of foods are given to the patient. So you need to be aware of those names. So that is why practicing more questions, mainly pharma and the diet questions, you need to practice more so that you are aware of all the pharmacological drugs names and the diet sources also, right? This is the same thing which I just said, ma'am. Next. So this is the course overview. Rest calendar will be shared, but this is just overview which we have planned. And as I told you, if it is not suitable to anyone, we can discuss it. If any solution is possible, we'll see. Then, so course duration is total 12 weeks duration is there, 3 months is there, and we will be having classes for 5 days a week. And I recommend that at least on the day of when we will discussing the question paper, no, at least that day, everyone should be present, because that will be a kind of practice also to you, right? How to attempt the question. And we will try to attempt it on a live class so that you can manage your time also. So weekdays, Monday, Tuesday, and Wednesday, 3 days we have kept from 11 a.m. to 1 p.m. IST. And on Saturday and Sunday also we are having classes. Sometimes according to the content, 6 to 7 or 6 to 8 p.m. it will be there. And the schedule of subjects, we have divided all the subjects which we study in our 4 years graduation nursing. We'll be studying the same subjects, but as you all know, like first week is FON or Foundations of Nursing. All of you know it is a vast syllabus divided into 1 year. First year you study FON, no? So it's not possible to cover everything. We will be studying the major topics of FON from Monday, Tuesday, Wednesday, and Saturday. And at the end of every week, there will be a mock test. Okay, that will be a short test of 1 hour. And then when we have covered all the syllabus, at the end, we will be having more exams. So first week, we will be doing FON, and second week, MSN again. You know, it is a huge number of diseases are there. So we have tried to cover it up in 1 week. 1 week we'll be studying MSN from Monday, Tuesday, Wednesday, and then Saturday, Sunday. So there's a break of Thursday and Friday in between. Okay. Then third week will be whatever topics of MSN we have covered, we'll be doing only mock tests in the third week. So I'm telling you in advance. So if possible, please try to be present on the third week for all the mock tests, because it will be only mock test week. So it's better if we attempt the questions together, because there will be discussion also. And the question paper discussion is different from the theoretical classes, because many times we feel that this answer is correct, but it turns out to be something different. So if it's possible, then please be present on the third week. Then fourth week will be for child health nursing, and at the end there will be a mock test. Then fifth is for OBG nursing. At the end, mock test will be there on Sunday. Then mental health nursing will be covered on the sixth week. Then seventh week we have given for miscellaneous topics, which are separate from these specialties, like pharmacology, ethical and legal issues, then emergency nursing, drug calculation. These are small topics which do not fall under any of these specialties, and it's a part of all specialties. So we will be covering miscellaneous topics at the end. Then the eighth week is again after third week. The eighth week is only for mock tests. So please be present for that also. The miscellaneous topics mock test will be done in the eighth week. And in the calendar, you can see the exact dates also, which will be shared with you, right? So just try to adjust your dates according to duty hours. Then after the eighth week, and in like 2 months, our whole syllabus will be over. Then last month is dedicated only to practicing more and more number of questions, in which live question paper will be discussed. You will be attempting side by side, you will be posting responses, and then we will discuss the answers. So I think that is from mid-November to December. So if possible, try to be present during those exams also. It will be a comprehensive testing, means before we were doing only specialty wise question papers, but in comprehensive tests, every mix up of all the specialties will be there. So it will be a kind of actual practice of the Nclex exam. So last week will be, I think 4 weeks will be dedicated to that. Okay. So we'll try to do 20 comprehensive tests. Otherwise, every class will be recorded, so don't worry about that. And apart from that also, ma'am will be telling you about Discord. So if you have any doubts related to any topics, classes, or questions, then you can always contact me on Discord. Okay, I think that is all about Nclex exam. So I hope it is clear to all of you what all you need to do in Nclex. Anything which you want to ask any one of you who has joined, means about the questions or how you are going to study. Any doubt anyone wants to ask?
Yes, ma'am.
Yeah. Yes, Akshay.
How much time will be given for the one question in the Nclex, ma'am?
That I think approximately, that is why we are doing live examinations, because you should give not more than 1.5 minutes to one question. And usually the case study questions, no, they are very time consuming. So, like if you have 150 total questions are there, you have 5 hours only, no? So, because case study questions take more time, so on an average, 1.5 minute should be given. Preferably 1 minute, but 1.5 minute can be given.
Okay.
Okay,
And
and there's no time limit. That I'm telling how you should attempt. There's no time
okay.
limit for the questions on the screen. There's no time limit, but you should divide your time accordingly, because otherwise you won't be able to do much questions. If the computer is not able to, do your assessment in 90 questions, then maybe the if 5 hours are over, then screen will turn off.
Okay, ma'am.
So on the
The-
question computer, there is no timeline for every question. But what I'm saying, 1 minute, 1.5 minute is for you to practice. Like you should be able to do in 1.5 minute maximum.
Okay.
Can I go? Exam centers will be in India or
Yeah. In
we need
India,
to go?
there are different centers and there are different dates also. Every month, there are many dates available for the exam. So according to your preparation, 3 months is a good time. If you're able to give 4 to 5 hours daily, then you can apply for the dates. I think academically is going to help you in that also. So exam will be in India, and in every country the exam centers are there and dates are available.
And ma'am, second thing,
Mm-hmm.
before that we need to clear the OET exam or
No,
after
after
that?
that, after
Okay.
Nclex, you need to do OET is for Canada, and for Australia it is IELTS, and US also IELTS. And for Australia, after IELTS, as Akram sir was telling, you have to go for OSCE also. So academically will again assist you in that. I hope you know what is OSCE. It is the means practical examination after this for Australia.
Yes, ma'am, we have to give OET or IELTS, ma'am.
IELTS for Australia and OET is usually for Canada.
I think, ma'am, we need to check on this because Dr. Akram was saying the nursing like practitioners can opt for OET as well.
Yeah, they
So,
can opt. Yeah, they can opt, but
yeah.
IELTS works for this Australia. And if you have seen the question paper, students, then IELTS is just English, but OET is English questions. They'll test your English knowledge based on nursing questions only.
Yeah,
So
so you were saying like OET is more preferable for the nursing practitioners because they can relate to the questions and everything. So we'll
yeah, that
confirm you, but as yeah, you can go for OET as well.
both can be done. Yeah,
Oh,
both can be done
yeah.
for Australia.
For Australia also both can be done, ma'am.
Yeah.
Yeah.
Oh, oh, okay.
Okay. I did PTE, and I was told that Australia they do accept that. I just don't know. Clarify that with me, because I've done
Yeah,
already
that's yeah, that's all that also works. OET, PTE or IELTS, they all are on same platform. So
Okay.
have you cleared out PTE?
Yes, I've cleared PTE already.
Okay, great. So now you need to just work on this NCLEX.
Yeah, it's the NCLEX. Does it mean I'm
Right.
supposed to apply for exam dates already, like now?
Yeah, I think you can apply because it takes time. You have to obtain the credential evaluation, and everything has to be done from your college or your board of nursing where you are right
I've
now.
done that already.
Done. Okay, then
I've
maybe
done that already. I've got the ATT, like the authorization to test.
okay, you
I've
have
got that
done.
one already. Yeah.
Then I think you should wait because after 3 months you'll be able to appear, no?
Okay.
You should be well prepared because it's a difficult exam, and hopefully if you clear it on the first chance, that's good na. So just wait for some time and then you can contact sir and he will guide you.
Okay.
Okay.
All right. Yeah. Because the letter that they gave me, it said, well, I've got about 6 to 7 months to write the exam, but
Mm-hmm.
I need to, I don't know, in 30 days, I need to actually decide which center I'm going to write, and I give them the dates when I'm supposed to write. I don't know if I'm supposed to apply for the exam date already, like today or
Where are
tomorrow,
you right now,
or
Florence?
after 3 months, huh?
Where are you?
I'm in Zambia right now. I came to visit, but
Zambia. So
I
ATT
reside in
is
South
done.
Africa. Yeah,
ATT is done.
ATT is done.
And anything else? The credential evaluation and all is done.
It's done.
Okay,
I'm
then
on
so I
stream
think
B.
Yeah, but then you can get a date means quite fast. There's fingerprinting and all also. That's also done for you?
No, 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 not the fingerprinting, but I
Okay.
did the, what did I don't think it's the fingerprinting, but I did the ID,
IDP
this,
is
what
done.
is,
Okay, okay, okay.
uh, yeah, the ID is done in Australia.
Okay, Bharti ma'am, who is guiding them for this all processing?
Yeah,
Who's
we
that?
have a dedicated department for this. So, Florence, no need to worry. We'll just answer all these queries. You can just put
Hmm.
them on Discord. Otherwise, you'll just connect with our executive. They will call you and they'll brief you everything about it. Okay,
Okay.
we'll arrange
All right.
for that. No
Okay.
need to worry for that.
Okay.
Okay, so I suppose you guys have been already informed about the LMS training and Discord training.
Yeah.
Yeah, so on your screen, you can see the LMS demo session. I suppose that it has been already done for each one of you. So there are two platforms where we are going to connect. All the sessions will be held on your LMS. The credentials must have been shared with you as you have joined this session. And Discord is one more application where you will be like free to connect with the faculties, as well as if you have like your like students can connect, and the support team. I'll just explain everything. And Zoom definitely you all must be having, that's why you are attending this session. So one more thing, that if you are iOS user, you need to do a little bit changes, and that too I'm sure right now Florence must have gone through all that.
Mm. Yes, I've
So
I've
if
gone through the credentials. I've gone through
yeah,
the PTE.
no, no, not that. If you're using a iPhone or a Apple device, you need to just check from your settings like Safari. You go to Safari and that block the pop-ups. So if any one of you is using this application on iPhone or any Apple device, you need to enable that. Now, as you can see, like this application is available for both the Android as well as the iPhone users. So you can just use it very conveniently. Then how to open LMS login page? That's again a very simple thing. Like you need to just go to the Academically website. There you go to the home page, then click on this sign in process. Like as you can see on your screen, the login option is showing on your screen. You need to click on there and just enter your this credentials. You need, your email ID would be your login ID, and the password is capital ACAD @123. So after that, you are good to start with the LMS. On the LMS, you can see the following icons. First is the dashboard that will show you all the updates, like which class are you going to have, the schedules and everything. And the announcement section is there. As the name says, all the new announcement will be popping up there. Then you have my courses option where you can just go and check about your course, that is Nclex, right? So here, as on your screen, it shows CAPS exam miles. But yes, in your case, once you click on Nclex, you can check on the Nclex part, right? So the content would be there, like course and content option would be there. You can just check it from there. Everything will be uploaded very soon. Then the lectures part, there Nclex lectures would be there, Nclex handouts, mock and class PPT. So all will be showing to you on your LMS content part. Then, so as I told you, like there are 3 4 options. Each you can just click on the desired option. You can just have it. Like additional lectures, if they are going to add, you can click on that and check on that as well. Then you can see the calendar. Here, all the classes will be blocked already for you. Like from tomorrow onward, it will be start showing on your this calendar part. So you can plan your classes and your schedule accordingly, right? And then there are like options of feedback and messages. You can just click on that and just share your feedback if you want to share any. Then this is again the new option is there. You can just click on that and send the message, and then select it. You can create. So I am sure you all are aware about this.
Okay, fine. So, students, that is all in our orientation session for today. And if you have any doubts, no, you can all you after you have downloaded Discord, so you can ask any questions there. whether it is, as Bharti ma'am has already told you, whether it is technical related thing, or if you want any to ask any questions
Yeah,
from me.
there are designated like three platforms are there. The support is there where you can ask all your technical and non-scientific queries, and in the faculty connect you can just connect with Kavita ma'am. You can just leave your question and she will definitely resolve and like answer your query. And this way, and informations and announcements would be there, so there you will be notified about everything what is happening. And additional content is also there where we are going to share if there are any PDFs or anything extra you need to be aware of. And apart from that, we are always hands-on ready, and the elements notifications are definitely being like pop up on your screens, and you will be notified through mails also.
Okay.
Yeah, I hope everything is clear to you, and otherwise it's a long journey. Definitely hands-on with you all.